Welcome back. Prostate cancer is the second most common cancer among men, with more than 170,000 new cases last year alone. It's also National Prostate Cancer Month, and radiologist Dr. Robert Princenthal, he joins us to get us up to speed with the latest treatment, also prevention. So welcome, doctor. First, I want to talk about it's Prostate Cancer Awareness Month.
Yes.
Why is this so important?
It's important because men tend to be chickens and cowards when it comes to being involved with preventative measures. Women have done a much better job with breast cancer awareness and Breast Cancer Month.
Yeah, and another thing I want to talk about, what are some of the controversies regarding PSA screening?
Yes. The government in 2008 came out against PSA screening. They were complaining that there were too many harms, too many biopsies, and not enough cancers being found. So they said PSA screening doesn't work. But now, when we work collaboratively with the urologists and the primary care doctors, if you overlay imaging, we can finally image the gland and figure out who might benefit from a needle biopsy instead of just having what we call the blind poke and hope, which was what was being done before.
Yeah, and another thing is, are there better options to improve this cancer, the prostate cancer detection?
Exactly. So we believe that all men from 50 to until they're 75 or 80 should get a physical exam and a PSA. And if the PSA is rising or they have other risk factors, they should ask their doctors to get an MR of the prostate. Because with MR, now we have level 1 evidence that shows that prostate MR is cost effective and it helps us find more cancers, and it can also exclude men needing a biopsy if the gland looks totally normal.
So for men, it's age 50? I always thought it was 40 for some reason.
No, well, the guidelines are 55 to 75,
Gotcha.
But we're seeing younger and younger men getting prostate cancer, so we think you should start at 50.
Good to know. And how is prostate cancer diagnosed? It's a big question a lot of people have.
Well, it's an unpleasant procedure. It's a biopsy done by a urologist, and it's done through the rectum, and men can have bleeding and infections and other challenges from the biopsy, so they're reluctant. And also with the treatment, when the prostate's removed, a certain number of men have what we call I-squared, impotence and incontinence. Those side effects are being reduced with improvements in surgical treatment, but still that's leading to men being reluctant to get tested.
Yeah.
They shouldn't be more afraid of the treatment than the disease. We can do better together.
Yeah, and you were saying it's the most common cancer behind skin cancer. As far as for improvements out there, what improvements are now available for this treatment?
Well, with accurate MR, we can better assign men to a category we call active surveillance or watchful waiting. So if you have a small, low-grade prostate cancer, you can do nothing. You can watch it, and you might live a long time and never have your prostate cancer cause harm. But before we had imaging, frequently we wouldn't know what was missed on needle biopsies, so men were being often encouraged to be overtreated and have their prostates removed without any clear benefit.
Oh, and tell us briefly about prostate MRI.
It's a 25-minute exam. It's in a MR machine. You get a little dose of IV contrast, and we combine anatomic imaging with functional imaging, and now with experience we're become very good and accurate for finding significant cancers.
And to wrap it up, for men out there, get checked at 55 up to 80.
Well, as long as you're healthy.
As long as you're healthy. All right, well, good to know, doctor. Thank you so much.
Thanks for getting
joining
the message
us, and stay with us. We'll be right back.